Hi, my name is Katie Shaw, and I will be presenting over high blood pressure. What is high blood pressure? High blood pressure, also known as hypertension or high or raised blood pressure, is a medical condition characterized by a persistently elevated force of blood exerted on the blood vessel walls. As of 2022, hypertension is the most prevalent primary diagnosis in the United States. This graphic shows what a normal blood vessel looks like, as well as the effects of prehypertension and hypertension on our blood vessel walls. This video is just a quick rundown of what blood pressure is.
Understanding blood pressure. Your heart pumps blood, oxygen, and nutrients through the arteries in your body. Blood pressure is the force of blood against your artery walls. There are two readings which measure blood pressure. Systolic pressure is the higher number. It measures the force of blood being pushed around your body when your heart contracts. Diastolic pressure is the lower number. It measures when the heart relaxes between beats. High blood pressure is when your blood pressure is always higher than it should be. This is also known as hypertension and is usually diagnosed when your levels are always above 140 over 90 millimeters of mercury. High blood pressure makes your arteries less stretchy and damages the walls of your arteries. This makes it easier for fatty deposits to build up and limits the circulation of blood and oxygen. This can lead to a heart attack or stroke. High blood pressure typically has no symptoms. If left untreated, it can lead to heart and circulatory diseases. Anyone can have high blood pressure. It can be caused by eating too much salt, drinking too much alcohol, being overweight, or not being active enough. Take control of your blood pressure and find out more about the life-saving research we fund.
Like mentioned in the video, traditionally, normal blood pressure is considered to be 120 over 80 or lower. According to Mayo Clinic, elevated blood pressure can range from 120 to 129 over 80, which causes concern for potential hypertension. A blood pressure consistently higher than 130 over 90 is called stage 1 hypertension, and a blood pressure reading of 140 over 90 or higher is called stage 2 hypertension. The majority of individuals with high blood pressure do not exhibit any symptoms, and most major complications don't occur until the blood pressure reaches a severe or life-threatening stage. In rare cases, severe high blood pressure can result in shortness of breath, headaches, nosebleeds, dizziness, nausea, blurry vision, and a fluttering or racing heartbeat. When an individual has hypertension, the heart has to work harder to pump blood throughout the body, which causes an increase in strain of the arteries. This may lead to the vessels wearing out prematurely and impaired circulation. As depicted in this graphic on the right, the heart becomes enlarged in response to the increased amount of effort in pumping blood, particularly in the left ventricle, which acts as the pump for systemic circulation. According to Crowley's An Introduction to Human Disease, although the enlarged heart may be able to function effectively for many years, eventually the heart can no longer maintain adequate blood flow and the patient develops symptoms of cardiac failure. Other possible health consequences that can happen when high blood pressure is left untreated include kidney damage, vision loss, memory loss, erectile dysfunction, heart attacks or heart disease, congestive heart failure, stroke, angina, and fluid in lungs. The most common type of high blood pressure is called primary hypertension. Primary hypertension is described as an individual having no other medical conditions found that cause the high blood pressure. Various groups at high risk for primary hypertension include those who have high to normal blood pressure, have a family history of high blood pressure, and/or are of African American ancestry. In addition, men are also more likely than women to be diagnosed with hypertension. Some common issues that can increase the risk of having high blood pressure include older age, genetics, being overweight or obese, not being physically active, high salt diet, and excessive consumption of alcohol. 95% of cases of hypertension, essential hypertension, have no easily identifiable cause, but rather are multifactorial with genetics, salt intake, and vascular tone all playing a role. In 5% of cases, hypertension results from a known disease or condition such as chronic kidney disease, endocrine gland dysfunction such as pituitary or an adrenal tumor, or a hyperactive thyroid gland. When medical problems result in high blood pressure, such as the ones mentioned in 5% of all cases, it is called secondary hypertension. Conditions that may cause secondary hypertension include kidney disease, hormone problems, blood vessel problems, obstructive sleep apnea, heart problems, lung problems, and some medications. Primary prevention methods for hypertension focus on adopting preventative measures from an early age, which is considered the best long-term method of preventing hypertension. The absolute risk reductions of high blood pressure are more likely to be achieved with lifestyle changes such as proper nutrition, weight loss, reduced salt intake and moderate fat intake, moderation of alcohol consumption and smoke reduction, stress reduction, health education, and physical activity. Additionally, potassium supplementation and modification of eating patterns has been shown to be beneficial in prevention of hypertension. Through regular monitoring and implementation of these lifestyle changes, individuals concerned with high blood pressure may maintain control over their risk and promote a healthier cardiovascular system overall. In addition to the lifestyle interventions mentioned, there are various public health approaches that can be implemented to reduce the average blood pressure of communities, such as lowering sodium content or caloric density in the food supply, and providing attractive, safe, and convenient opportunities for exercise. Improving population-based access to facilities that encourage physical activity, such as walking trails and bike paths, is another beneficial and effective method for promoting health, further improving average blood pressure. Secondary prevention methods of hypertension include early detection by consistent checkups and monitoring, beta blockers, and calcium channel blockers for blood pressure lowering. When dealing with secondary prevention methods, patient compliance in taking medicine, diet, and other changes is incredibly important in preventing severe symptoms and issues later in life. Through treatment, high blood pressure can be controlled. Tertiary prevention measures for individuals with hypertension include avoiding or minimizing damage in the target organs of hypertension, such as the brain, eyes, cardiovascular system, and kidneys. Ongoing management, even in the absence of symptoms, adherence to prescribed medications, and regular monitoring are all components of minimizing severe damage to organs affected with high blood pressure. Although the reason for hypertension cannot be determined in most cases, blood pressure can be reduced to more normal levels, thereby lowering the risk of complications of high blood pressure in the future. This can be accomplished by administering various drugs that lower the blood pressure using a variety of mechanisms. Commonly used drugs include thiazide-type diuretics that increase the ability of the kidney to remove salt and water from the circulation, thus lessening the load the heart must pump against. Calcium channel blockers inhibit the contraction of arteriolar smooth muscle cells, lowering peripheral resistance. ACE inhibitors reduce the production of angiotensin II, which is a potent vasoconstrictor. Several other classes of antihypertensive drugs can be useful in particular clinical circumstances. In summary, high blood pressure or hypertension can be a severe and concerning medical condition that affects a significant portion of the population. It is often devoid of symptoms until reaching critical stages, emphasizing the need for regular screenings and awareness. Understanding the varying stages and causes from primary hypertension to secondary hypertension is key to preventing future complications of hypertension. Lifestyle modifications, including dietary adjustments, physical activity, and overall health education, are a few of the fundamental aspects of primary prevention. Public health initiatives further reinforce the collective effort required to combat this issue. Treatment options aim to mitigate the strain on the cardiovascular system and reduce the risk of associated complications. Adherence to prescribed medications and ongoing monitoring are important components of secondary and tertiary prevention measures. Ultimately, a comprehensive approach involving both the individual commitment and a broader societal intervention remains paramount in curbing the prevalence and impact of high blood pressure on public health. Here are my references. Thank you for watching.